Hello and welcome to my presentation on supportive employment services for individuals with autism spectrum disorder. Here you have a brief overview of what is autism. It is the most common condition in a group of developmental disabilities collectively known as autism spectrum disorders. That spectrum does include ADHD, bipolar, OCD, various learning disabilities, Tourette's, schizophrenia. There are any number of things. It basically, autism spectrum disorders are brains that are wired differently. Doesn't mean that they're wrong. It doesn't mean that they're bad. Doesn't mean that they need fixed. They're just different. And that difference makes people with autism sometimes have difficulties communicating with people who have neurotypical development. We typically refer to people with autism as neurodiverse rather than neurotypical, which is, of course, typical brain development. It is pervasive and lifelong, although symptoms may improve with treatment and age. Autism is typically characterized by four main symptom clusters: verbal and nonverbal communication issues, impaired social interaction, primarily because of the behavioral issues, the communication issues, unusual, repetitive, or significantly limited interest in activities, and sensory issues. These can be hyper or hyposensitivity to various stimuli. It is common in ASD, very common, and may range from irritating to debilitating. There's also reduced sensitivity to pain across the board in most people with autism. They're at a higher than normal risk for comorbidities such as Fragile X, tuberous sclerosis, epilepsy, Tourette's, OCD, bipolar disorder, mood and anxiety disorder, psychotic disorders, learning disabilities, ADHD, etc. It is a very complex disorder. There are multidisciplinary evaluations that are required to diagnose, and the treatment strategies are also multidisciplinary. Current theories as to what causes it is unknown at this time. Typically thought to be brain abnormalities in early development. There's a wild growth of synapses, excessive neuroplasticity. There is genetic contribution, early developmental interruption to normal brain development. Something happens early on in development to interrupt the normal brain, leading to neurotransmitter irregularities, functional impairments leading to, the sensory issues leading to functional and anatomical issues, irregularities, things like that. Treatments include cognitive, behavioral, educational, psychological therapies. Medications are sometimes given to control severe or potentially harmful behaviors or symptoms. Okay. This gives some current statistics on autistic people in the workforce. Only about 25% of Americans with ASD are employed. Just 6% are in competitive employment. What that means is only the 25% that are employed, only 6% of those are employed in a competitive field, meaning they have advancement opportunities. Their job is skilled, is a professional setting, things of that nature. Majority of Americans with autism that are employed earn below minimum wage. They often experience periods of joblessness in between jobs. There's frequent job changes. There are a lot of different reasons for these. Again, it comes back to the social interaction, the communication issues. Put yourself in the shoes of someone who doesn't understand certain verbal cues, who takes things very literally, who doesn't understand sarcasm, who doesn't understand nonverbal behavior, body language, things like this, context. Clues aren't always gotten. And the niceties of communication, the small talk, the, hi, how are you? I hope your day is going beautiful. In an email, in a work setting, might be very, very difficult for them to understand and to accomplish much more prone to be straightforward and direct. Sometimes that is read as confrontational or rude. So there's a lot of communication differences between neurodiverse and neurotypical people that can cause a lot of issues in the workplace. There are a lot of other factors that go into that, but just briefly, the individual characteristics. Did I go too far? Okay, I went too far. Anyways, vocational rehabilitation tends to help. It is one of the first services that would provide vocational placement, vocational assistance, job coaching, help, things like that, for people with autism. 52% competitive employment after VR services. So they do have a fairly decent success rate with autism. Despite their success rate, again, many ASD people remain underemployed and have limited wage and hours. The individual characteristics, employment outcomes, they're of course influenced by your cognitive ability, severity of the impairments, social skills, self-determination, independence in daily living, which is often more of an issue with autism in younger adults. There are transition programs that are highly recommended, but they're not implemented very often. A lot of educational opportunities in that realm are lost. Job training on the job, and job training, job experience, work experience while you're in school, a trade kind of schooling, things like that are typically very helpful for people with autism. And transition services, transitioning out of high school into the workforce or out of high school into college, more independent living, things of that nature. These programs are few and far between, and they would be extremely helpful. But getting off the soapbox, you also have external factors. Again, there's special education services, community integration, and vocational supports can enhance employment success. We're going to come back to this issue of supportive employment. Provides intensive ongoing support, including job placement, on-the-job coaching, and extensive follow-up. So that's basically where we're going to focus our attention today on this, and the design of this program is around that supportive employment model. So moving forward, the employer plays a huge role in employee satisfaction. Supervisors and coworkers being knowledgeable about ASD and supportive leadership styles are crucial. Education, sensitivity training, things of this nature within the business itself, within the company, within the workforce and the colleagues and things of that nature, and leadership. ASD is not often addressed, even when you have ADA accommodations, even when they discuss disability services and how best to interact with people, best practices in dealing with employees who are disabled. Autism is a different beast, so it often have the problem of people really not understanding what it is and not having a clear understanding. Here in the company that I work for, we are a community mental health agency. We do have supportive employment services. However, if someone has autism as a diagnosis on their chart, they will not be accepted. Their therapist, their case manager, whoever has referred them will be told that our supportive employment services are not equipped to deal with the specific needs of autistic people. Pardon my French, but it's a bunch of bullshit. And it's all about people not understanding what autism really is, not understanding the needs of these people, and the particular benefits of having them in the workplace. So, expressing accommodation needs, that is a massive issue. Not only do you have to know what your needs are, to know what accommodations are even available, what can be done to help you. But you have to then approach your supervisor or your leadership or your HR or your disability advocate and ask for help. That's a huge thing. For someone who has communication issues, that's a massive ask. So it is extremely important. Part of the job coaching, job training process, the placement, not only to educate the employee, but the employers, the workplace. Also, it would be the part of the job coach to educate the client, the autistic client, on how to deal with needing accommodations, on what they can ask for and what they can't, on what's reasonable and what's not, on what can be expected of them and what can't, and how to set them up for success rather than setting them up for failure, which is what often happens. Employee support programs are invaluable. Employee assistance programs, employee wellness programs, mental health care benefits. Employee resource groups are often a massive help for employees who are autistic. And, in my organization, we do have a employee resource group called Working Outside the Box that is specifically to help people with ASD or with any neurodivergent condition. We come together and provide support for one another. We advocate for one another. We provide resources for one another. And it really is an employee-led group for employees. So there's a lot of support to be had there. But it took someone with autism, someone who is neurodivergent in our company, to feel safe and secure enough in their own position to step forward and want to start a group like this. And that's rare, unfortunately. But that's something that can be encouraged by a job coach within this kind of a program. Recommendations, again, all of these things are crucial to the success of autistic people in the workplace. So what can help? What can we do that's going to help people with autism? How can we help them? How can we help set them up for success in the workforce? Accommodation and rights, the positive impact of employment, understanding that to kind of improve motivation, understanding of the complex predictors of employment, improving vocational skills, the need for long-term planning. There's a lot of research, a lot of funding, a lot of money being pumped into the idea of early intervention in autism. And while that is critical for a lot of kids with autism, the follow-through for those kids doesn't really happen. There's not a lot of research out there about how to become an autistic adult and what happens and how you integrate within the workforce, within the community, within the social structure. When you get out of that very structured environment of school, then what happens? What do you do if you made it through school? The social interactions, the verbal and nonverbal communication issues, cognitive deficits, if there were any, may have prevented them from even being able to finish school. And that, of course, is going to lower your employment prospects. Intervention targets. The applied behavioral analysis. Don't get me started. Anyways, organizational skills, self-management, safety, communication, interpersonal skills, social skills training, things of that nature can be helpful in some cases. Education and self-awareness is often more important and more beneficial than trying to fix the autistic person. It's trying to make them aware of what their strengths and weaknesses are and strategies they can use to work within their own framework to achieve success and achieve their goals. having a supportive work environment, benefits for employees, the opportunity of promotion, promoting employment, promoting supportive interventions, increasing motivational interviewing, helping them understand that they can be, a working part of society. They don't have to be on disability for the rest of their life. They can achieve their goals. They can go to college. They can get a great job. They can be a doctor. They can be a lawyer, whatever. They can do whatever they want. But they need support and they need help to achieve those goals and to get there. So that's where we come in. Teaching general employment skills, things like that. All of that can be done within workshops, within skills training, within job training, whatever comes with the particular job placement. So employment disadvantages, again, a lack of understanding and support in the labor market. Most people with autism are very willing to work. They want to have a meaningful job, a meaningful career, but knowing how to get there, knowing how to maintain it, and being able to function within that environment is often more challenging than they can accomplish by themselves without support. So support is very important. Challenges in job seeking and employment, job interviews. Massive, massive. Writing a resume, communicating, sending introductory letters, thank you notes, and all of the little niceties that we have to observe when we are looking for jobs. All very, very difficult for a lot of autistic people. So that's an area that can definitely be helped in. There are unsuitable jobs for some autistic people, and again, this can be very individualized. So taking a very careful inventory of their strengths, their weaknesses, what they need, what they don't, what they're good at, what they're not, what they're interested in, what they're not, and not setting them up for failure by encouraging them to look for jobs that are going to be very unsuitable to them. Positive employee characteristics. Again, this is something to promote to any potential employers. Adults with ASD are often honest, efficient, precise, consistent. They have low absenteeism and are disinterested in office politics. So they're very good employees. Employment outcomes, again, jobs below their own ability levels, difficulty maintaining employment due to lack of support. Another issue is over-education. Not meaning that education is ever a bad thing, meaning that school is structured. We know what's expected of us. And we can go into school, we can go to college, we get used to that format, we can achieve things there, we can get a great education. But with our work history, it's being spotty, it's been a lot of job changes, you haven't held jobs for very long, does not look good to potential employers. So you're put in at an entry-level job when you have the education to get you a professional level. And of course, overeducated, underpaid, underutilized, undervalued, underappreciated helps decrease mental stability, increases depression and anxiety, decreases job satisfaction, decreases satisfaction within yourself, makes you feel like you're not worth much, I guess is the best way to put it. Support for job seeking. Fewer than half of individuals with autism receive assistance in finding jobs. Many rely on informal support. Over half need support to find new jobs. Job satisfaction. So we've gone over the needs, and let's quickly run through the program design, designing a supportive employment program specific to autistic adults. So again, we talked about the supportive employment model, going over some of the features and benefits of that. It is a comprehensive scheme for assisting people with disabilities to achieve and maintain employment in competitive settings. It provides customized, intensive, and ongoing support, meeting the individual needs of the clients with ASD. Costs are initially high, but they are reduced over time, making it more cost-effective and beneficial compared to standard care. Positive impacts on cognitive performance, autistic symptoms, quality of life for individuals with ASD. Higher employment rates, working more hours, earning higher wages compared to peers without these services. So let's move on. Advantages of a supportive employment model. Here's the definition coming from the Developmental Disabilities Act of 1984. The individual placement model is what we're designing this program after. That is one-on-one job coaching, one-on-one help with job placement, advocacy, education, training, ongoing support, on-the-job training, retraining, whatever needs to happen. Also includes a lot of outside of the workplace assistance, maybe transportation, maybe helping set up a schedule, helping them maintain a routine, support groups, social skills groups, employee resource groups, or community groups that they can find support in. So yeah, things like that. Predictable jobs are adaptable to a schedule. Receptive employers and coworkers, clearly defined work tasks with low areas of few distractions, meaning in the long-term support, site visits, phone calls to employers, family contact, social groups, community skills training, all these kinds of things that they don't teach you in school, like how to live and how to function as an adult, how to do your taxes, how to balance your checkbook, how to do laundry, how to pay your bills online, all those kinds of things. These are things we can help with. Planning, implementation, and evaluation of this program. It will be modeled after the TEACH program. Supportive Employment Service employees will be TEACH certified. TEACH was developed specifically for autism, or there has been a TEACH program specifically developed for autism. It's a wonderful program. They've had great success. It's a relatively inexpensive program in the long run. It's something that can be implemented easily. They have additional trainings for train the trainer on top of the initial level certification. Again, go into the cost there. The cost per individual served on average for most supportive employment programs, it's about $4,000 averaged across an 8-month service period. Funding primarily through grant applications, Medicaid, private insurance, or state funding. Initially setting up the program through a well-known community assistance agency such as a community mental health center, vocational rehabilitation, autism-specific advocacy or service group, etc. This is to reduce overhead and simplify the process, simplify HR and administrative tasks. Partnering with community agencies and forging relationships with community partners, employers, training sites, referral sources, etc. will be the first task. Referrals will come from these sources, as will job placements. Evaluation will be completed yearly based on a number of factors, including client satisfaction, percent job placement and maintenance at periods of 6 months, 12 months, 18, and 24. Ability to stay within budget or secure additional funding as needed. A reduction of cost overall, an increase in revenue to the agency, and satisfaction levels of the community partners. And the rest is just some tips for overall success. You can read through them as you like. Forming community relationship tips. So tips for creating a successful supportive employment service, tips for making better relationships, forging relationships within the community. This is about 3. pages here. Provide comprehensive training and education. Learn from other reputable providers of employment services. Utilize existing relationships with employers. Foster creativity. Hire staff with the right personality and commitment beyond just the skills. Be patient and trust that the right team and training will bring success. Start small. Understand your funding streams. Consider the whole person. And we are providing support not just for employment, but for all aspects of their life. Find jobs where people can thrive, not just placements. Work to find the good fit. Communicate effectively. Build strong relationships. Maintain open communication. All of these things are tips for success and critical to the success of your endeavor. So there we go. Thank you for listening and for being here. There is a one-page flyer that will be attached to this for the group. So thank you and have a good day.